So our first section here tonight is lead education and tips for preventing lead exposure. So we're going to start back to basics. Some of you all might know this information and some of you all might be hearing this for the first time, but what is lead? So lead is a highly toxic, naturally occurring metal found in the environment. It's very soft and malleable, so historically it was used in a lot of different products. In the United States, lead-based paint was banned in 1978 and lead service lines were banned in 1986. However, there are still a lot of homes that either have lead-based paint or lead service lines, and as our infrastructure continues to deteriorate, the risk of lead exposure through these routes just increases. And lead primarily enters the body through two main routes, so ingestion or inhalation. With ingestion, children can either consume small pieces of chipped off lead-based paint, or a piece of jewelry made of lead, a piece of a toy that has lead in it. And with inhalation, children can breathe in really fine lead dust, which usually happens from lead-based paint being worn away from high friction surfaces. Or if there's any lead contaminated soil in a building or outside of a building, children can inhale lead that way. Now, why are young children specifically the most at risk? So, of course, this whole webinar is about childhood lead poisoning prevention, and those young kids are more at risk than adults for a bunch of different reasons, which I've highlighted here. For one, they spend a lot of time on their hands and knees crawling on the floor, so they're just more likely to be exposed to any lead hazards on the ground. You all in your work as childcare providers with young children, you know that kids are always putting their hands in their mouths, and that also just increases the risk of them ingesting any lead that they get on their hands. They're rapidly growing and developing, so lead really interferes with that fast growing process that's happening when kids are so young. And similarly, the bodies of young children just absorb lead at a faster rate than the bodies of adults because they are going through that rapid development stage. Now, you can learn all about other populations that are also at higher risk for lead exposure if you click the link on this slide. And reminder, you'll have access to these slides after the webinar. But remember, all children can be exposed to lead and harmed by lead. Now that you know why young kids are at risk for lead, I wanted to really dive into what those negative health impacts are of lead exposure. So unfortunately, there are a lot of negative health impacts of lead exposure to young children. Exposure to lead can cause slowed growth and development, learning and behavior problems, hearing and speech problems, and damage to the brain and nervous system. All of these negative health impacts over time can lead to decreased IQ, inability to pay attention, decreased performance in school, and increased aggressive behavior. And you all in your work with children wanting to create a safe and supportive learning environment, if children are exposed, this can really interfere with their ability to learn effectively, and they can fall behind their peers. Now, I've touched on some of these already, but I also felt it was really important to dive into what the different sources of lead are. Unfortunately, there are a lot of different sources of lead, but I wanted to highlight what some of the most common are and what some of the most common are that you might see in a childcare setting. So the first, of course, chipping and peeling lead-based paint, which is found in homes built before 1978. Water from pipes and plumbing containing lead, that's another big exposure source. Lead-contaminated soil. Soil becomes contaminated with lead through a variety of different methods. One, leaded gasoline can settle into soil that's near a busy roadway or where there's a lot of just automobile traffic. Or if a home or a structure has lead-based paint anywhere in the exterior, as that paint starts to deteriorate, those small kind of paint particles can get into any soil around that building. And if children play in that soil, they can become exposed to that lead-based paint. Imported or antique toys, imported candy, certain ceramics and pottery, and traditional folk medicines and cosmetics. And that's something that we see more frequently in our immigrant and refugee populations. Now, I know you all, for the most part, are not healthcare providers, but I wanted to touch on blood lead testing. So most children that aren't exposed to lead don't show any sign or symptom that they are sick. It's not like the cold or the flu where there's physical symptoms. Lead, for the most part, absolutely no indication that they've been exposed. So the best way to know for sure if a child has been exposed to lead is with a blood lead test. In Virginia, every child that falls under any of these risk criteria listed here on this slide must get a blood lead test at ages 1 and 2, or up to age 6 if they have not yet received a blood lead test. And I won't get too down into the weeds about this, but you all have such a great connection to your communities and the parents of young children. And so it's really important for you all as childcare providers to at least have a good idea of how blood lead testing works in the state of Virginia. And to support that, you all might think that, not as healthcare providers, what role do I play? But with that connection and with that network in your community and the parents of young children, you all can support blood lead testing and, help inform them of the need for children at risk for lead exposure to get blood lead tests. And there are a few ways that you can do that and support blood lead testing in Virginia. One is to give parents the VDH Lead Safe Lead Risk Checklist. That's this document I have on the right here. It has all of those high risk criteria from the last slide written out in like a yes or no checkbox format. It's a great document for parents to review to kind of prompt them to thinking about whether or not their child is at risk for lead exposure and whether they should get a blood lead test. You can also hand out or send parents our other lead safe educational materials that cover lead poisoning prevention and why blood lead testing is important. And I have all of those materials linked here on this page. And also you can explain that a blood lead test is the best way to know for sure if a child has been exposed to lead. You can mention that you attended this training webinar and you learned all about what those risk criteria are. And those are all great ways to support blood lead testing across Virginia for those at-risk children. Now, in addition to those blood lead testing efforts, there are also some really simple and effective steps that you all can take as childcare providers to prevent children from being exposed to lead in your childcare location. And I have them broken out into kind of 3 different steps. So we have clean, educate, and then kind of lumped together, inspect and address. So we'll start with clean. This one's fairly intuitive, fairly straightforward. Do things like wash your toys often. Make sure all children are washing their hands before eating. Wipe down counters, tables, and food preparation areas daily, and wet wipe and wet mop floors, baseboards, windowsills, and entryways weekly. All of these cleaning methods just reduce the risk or likelihood of any of that lead dust or those fine lead particles being anywhere around the location where children could contaminate their hands, putting their hands in their mouth. So these are great, easy steps to just reduce that risk of exposure in your setting. The second is educate. So showing young children how to wash their hands well. Now the CDC has a great hand washing campaign that I've linked here. They have tons of resources for good hand washing practices. That's a great resource to use to support this. Encourage good nutrition, and I'll talk a little bit more about that later. And like we just went over, encourage parents to take their children to get blood lead tests at ages 1 and 2, especially if they are at risk for lead exposure, and share lead poisoning prevention education with parents and caregivers to kind of prompt them into thinking a little bit more about whether their child is at risk for lead exposure in their own home. Now, to dive a little bit deeper into nutrition and lead, I felt this was really important because children are spending so many hours with you all as childcare providers, especially over meal times. Nutrition is one of the ways to protect children from the harmful effects of lead. A nutrient-dense diet full of specifically iron, calcium, and vitamin C can prevent lead from being absorbed in the body. And I also wanted to highlight to avoid giving out imported candies if you can. They may contain lead just because of different regulatory decisions in different countries. And I have highlighted here different sources of calcium, vitamin C, and iron. These are great things to keep in mind around snack time or even just to recommend to parents as they're prepping meals for their children. And that brings me to the kind of third and final group, which is inspect and address. So check often for chipping and peeling paint in your facility if it was built before 1978. If you find any, you should develop a plan to safely repair it. Now, there are a lot of considerations that go into repairing possible lead-based paint. So I have that linked here. The EPA has a great webpage all about lead-safe renovation and lead-safe paint repair. So I would definitely recommend utilizing those. Make sure you move cribs and furniture away from any possible sources of lead. Have your water tested for lead, and we'll go a little bit more into water testing later. But in the meantime, flush pipes for 60 seconds before use and use cold water only for cooking and drinking. And it's especially important to avoid using hot water from the tap for mixing infant formula. Some of you may have seen in the pre-webinar poll, we had a question about like true or false if you should boil water to reduce the risk of lead exposure. That is false. Hot water can cause lead to leach more from pipes and can actually increase the risk of exposure. And finally, have the paint and soil in and around your home or facility tested for lead by a certified lead inspector. EPA maintains a whole list of all of their certified inspectors, and I have that linked here. And that brings us to the end of the first component of this webinar. I'm going to pass it over to my colleagues Tandwa and Jessica for some lead safe policy. Tandwa and Jessica, just let me know when you want me to advance the slides.
Thank you, Janine. So we know that Head Start is our federal to local early childhood care and education program option. So they tend to serve the most vulnerable children and families in our state. And they also have federal guidance around lead testing requirements for our early Head Start and Head Start programs. So they currently follow the lead screening requirement under their EPSDT, which is the early and periodic screening, diagnostic, and treatment requirements. That's for Medicaid eligible children. It's the standard of well care that's applied to all children enrolled in Head Start and early Head Start programs. So as Janine highlighted, those children are required to receive screening for blood lead tests at 12 months or 1 year old and 24 months of age at 2. But if these children by the age of 3 or 36 months and 6, which is 72 months of age, they must receive a screening for blood lead tests if they have not previously been screened for lead poisoning at the ages 1 and 2. So that is essential. I know that people who operate Head Start and early Head Start programs, children are enrolled at different ages. So you wanted to have an awareness of this. There is a federal Head Start program performance standard that is linked here that highlights that lead safe policy that all programs must adhere to for implementation. Next slide, Jessica. Janine, I'm sorry. So we wanted to be sure to share some strategies with you to support Head Start blood lead testing requirements. So you can look at building some partnerships with local healthcare facilities. All Head Start programs have their Head Start Health Advisory Committee participants. So it's usually the health specialist that attends these state meetings, and they provide a lot of outreach to primary care physicians that can follow up and give resources that you can share with families. You can access a variety of resources through the Early Childhood Learning and Knowledge Center website. That is the website that is inclusive of all things Head Start. And I have a link here that can give you some strategies that are specific to lead poisoning prevention. We also want to be sure that you can access other federal agencies such as the Environmental Protection Agency or the National Center for Environmental Health. They share information as well. People work very closely with their state WIC agencies. So there are a lot of sources for you to be able to acquire great information to share with families and knowledge for your staff. But as a very last resort, programs are allowed to purchase lead screening equipment for students to be tested on site, but you have to ensure that that is the last resort. You do have a qualified person that is able to interpret the results, and they have access to a copy of the child's medical records from any previous lead tests that were conducted, and that those current tests would be shared with their primary care physician. So in the case, if they need a care plan to follow up, if they do test positive. So Jessica, I will pass it to you.
Okay, thanks, Tandwa. So I'm going to talk a little bit about the standards and statutes or laws that help reduce the risk of children being exposed to lead in child care programs offered in home settings and in facilities or center-based settings. There are different requirements in place depending on the program type that you operate. All licensed child day centers, licensed family day homes, and subsidy vendors, regardless of licensure status, are required to ensure that areas, furnishings, and equipment inside and outside of the home or center are maintained in a clean, safe, and operable condition. Each of the standard numbers listed on this slide have a different list of what unsafe conditions may include, but the one common trend between all of those program types includes chipped or peeling paint. And as Janine mentioned earlier, we all know that children love to touch things and put their hands in their mouths. They also love to pick things up and put them in their mouths or chew on things. So it's critical that you're regularly checking your physical plant for chipped or peeling paint and taking immediate action to resolve the issue when this occurs. You'll notice that these standards don't specifically reference lead paint, but ensuring that your home or center is free of chipped or peeling paint is a safety measure that helps reduce the risk of the exposure to lead, particularly in homes or buildings built before 1978. However, I do want to stress that each of these program types, regardless of when the home or building was built, is responsible for ensuring there's no chipped or peeling paint. Now, our licensed family day homes have an additional requirement under Standard 8 BAC 20, 800, 480E. This stipulates that equipment and materials used by children must be clean, non-toxic, and free from hazards such as paint, sharp edges or points, loose parts, and rust. So be sure to check labels of all equipment and materials before purchasing them or using them in your home to ensure compliance with this standard. Next slide, please. Voluntarily registered family day homes, which are home-based programs serving 4 or fewer children that voluntarily request to be registered with the department, have their own set of requirements. These programs are required to comply with criteria on the health and safety checklist at all times. The health and safety checklist requires that the home's in good repair with no peeling lead paint. Once you all receive the slides from today's webinar, the standard referenced in this slide will take you directly to the standards for voluntarily registered family day homes. But if you go to childcareva.com or use your phone to scan the QRG code on my background, you will access the Department of Education's child care website, where you can find the health and safety checklist under the section for providers and then voluntarily registered homes. And the last topic to cover is the legislation that was passed in 2020 that went into effect July 1st of 2021. This impacts licensed child day centers, licensed family day homes, instructional programs offered by public schools that serve preschool age children, child day centers that have obtained religious exemption through the department and serve preschool age children, and certified preschools operated by an accredited private school that have been approved for exemption by the department and serve preschool age children. Now, before I cause any panic about this new legislation, I want to stress that we are sharing this information because it is a statutory requirement related to lead safety. But please note that licensing inspectors are not yet determining compliance with this requirement, as we know that there's time needed for implementation. This legislation does require that our department work closely with the Office of Drinking Water with the Virginia Department of Health. And as you can imagine, putting resources in place for thousands of programs requires some time. So Janine's going to talk a little bit later about lead tasting and drinking water program that was recently launched by the health department. And as our department continues to work with the health department for implementation, we'll be sharing information with providers to help ensure compliance with this requirement. So once we are ready to proceed with implementation, the new section of the code will require that licensed child day programs and the other 3 program types mentioned develop and implement a plan to test potable water, which is drinking water, from sources identified by the EPA as high priority, which would include bubbler style and cooler style drinking fountains, kitchen taps, classroom combination sinks with drinking fountains, home economic room sinks, teacher lounge sinks, nurse's office sinks, classroom sinks in special education classrooms, and sinks known to be or visibly used for consumption. The plan and the results of each test will have to be submitted to the Office of Drinking Water with the health department. And if the results indicate that there is an unacceptable level of lead in the drinking water, you'll have to submit a plan to remediate the level of lead in the water. Those results of retest will also have to be submitted to the Office of Drinking Water. But do also know that rather than developing and implementing a plan to test drinking water or remediation, a program can choose to use bottled water, water coolers, or other similar water sources. And any program that chooses to do that will have to submit their plan and notification to Office of Drinking Water as well. So more to come on that in the future. And I'll pass it back to Janine.
Thank you so much, Tandwa and Jessica, for that great information. All right, that brings us to the final section of our presentation, which is resources for lead testing and removal, both for parents and providers. So I wanted to start by going over what lead risk assessments even are, just to kind of give you an idea of what to expect when hoping to undergo any lead testing at your facility or your location. So a risk assessment is just an on-site investigation done by a licensed risk assessor to determine if there are any lead hazards present at your location. And lead hazards for risk assessments include any possible lead in paint, dust, and soil. Like I mentioned before, EPA has a great lookup tool. They maintain a list of all of their certified inspection, risk assessment, and abatement firms. I have that linked here. So I would highly recommend using this tool to find a certified firm near your location. Now, it's really important to note that most risk assessments do not include water testing. However, as we reviewed earlier, lead in water is still a primary exposure source. So the next few slides have important information about methods for getting your water tested for unsafe levels of lead. Now, lead in drinking water, it's a complex landscape. Lead or water systems in general can be complicated and confusing. So we're going to give you just high-level information about the different types of water systems and what your water testing options are depending on your water system. So despite significant efforts to reduce lead in drinking water, there are still many lead service lines in place today. And like I mentioned, there are different options for finding out if there is unsafe lead in your water, depending on your water source. So the two types of water systems are public water systems and private water systems. Your public water systems are community water systems, non-transient non-community water systems, and transient non-community water systems. Your private water systems are private wells, which is what we're going to talk about today. Now, before I get into all of the different water testing options and resources that exist in the Commonwealth, I really wanted to highlight the existing lead rules and regulations that apply to public water systems. So first, the Safe Drinking Water Act. This was established to protect the quality of drinking water in the United States. It allowed the EPA to set standards to protect tap water, and it requires all owners and operators of public water systems to comply with those standards. Similarly, we have the lead and copper rule, known as the LCR. This was established to control specifically lead and copper in drinking water. Now, the LCR requires systems to monitor drinking water and provide action and education if there are too high concentrations of lead or copper. Now, the LCR applies to all community water systems and all non-transient, non-community water systems, and we'll go over those definitions in a few slides. It's also important to note that the LCR is a protective approach to identifying problems in a whole water system, not necessarily at your single specific location. So in addition to the testing done by the LCR for those public water systems, it can be really important to undergo testing at your specific location as well to get a more accurate picture of the water quality at your location. Now, considering that, I also wanted to highlight EPA's 3 T's for reducing lead in drinking water in schools and childcare facilities. The 3 T's are testing, training, and taking action. This is not a regulation, but it is a recommended framework for implementing a voluntary water testing program to reduce lead in drinking water, and I have that linked here as well. Now, in terms of testing options, so first I'm going to start with community water systems. So I have the definition in italics there at the top. Community water systems are a public water system that serve the same folks year-round. Most residences are community water systems. A great testing option or a way to get an idea of the water quality at your location is with consumer confidence reports, or CCRs. So the EPA requires all community water suppliers to test their water quality regularly, and the results of these tests are found in CCRs. So just ask your water supplier or your landlord, if you live in an apartment building, for a copy of the CCR for your address. Now, if you've never seen a CCR before, it's just a jumble of numbers and letters and charts, and it can be very confusing. So I have linked here a great graphic for understanding what you're looking at when you have a CCR, and it really helps you kind of figure out what those numbers mean and what action to take. You also are welcome to visit the VDH Office of Drinking Water page for more information about CCRs. As Jessica mentioned before, the Office of Drinking Water is Virginia's regulatory body for safe drinking water, and I have their website linked here, as well as CDC's Consumer Confidence Report page. Now that brings me to another public water system, non-transient, non-community water systems. These are public water systems that regularly supply water to at least 25 of the same people 6 months per year. So any school, daycare center, church, or anything with its own water supply is considered a non-transient, non-community water system. A great testing option for this water system is the Healthy Babies Bright Futures water testing kits. This program is partnered with Virginia Tech to provide at-cost drinking water kits, and they do high-quality laboratory analysis of the water samples. So they will send you a test kit in a return mailer, and they will do analysis of all of your water samples. They'll provide you with detailed results based on the analysis done at Virginia Tech, and they'll give you a clear set of customized actions you can take to reduce exposure at your location. And I have linked here the site where you can order your water testing kit. Now, for private water systems, those are water systems that serve no more than 25 people at least 60 days of the year. Most private water systems use groundwater wells. So if you have a private well, then that is a private water system. Now, EPA regulations that protect all of those public water systems, like the Safe Drinking Water Act, the LCR that we discussed earlier, they do not apply to privately owned wells. So as a result, any owner of an individual water system or a private well are responsible for ensuring that the water is safe at that location. There are a few water testing options for private wells as well, such as the Healthy Babies Bright Futures program that I just talked about on the last slide. They will test well water as well. Another great option for testing in private water systems is the Virginia Household Water Quality Program. Now, that program hosts drinking water clinics across the Commonwealth. Those clinics will inform citizens of the water quality issues in that specific area. They will distribute reduced cost water sampling test kits, and they will walk you through how to do correct water sampling at your location. Those water samples are also sent to Virginia Tech for analysis, and those results sent back to the homeowner with a whole action plan based on the results of the water quality. Now, I have linked here where the drinking water clinic schedule is. However, if there is not one happening near you or not for a while, I have the program head's information here on this slide. You are more than welcome to reach out. She's happy to work with you on getting water samples submitted for testing and analysis. Another great thing about this program is they test for other contaminants in addition to lead, including bacteria and nitrate. So it is a great option. Now, as Jessica alluded to, I want to highlight a great testing resource coming out of the Department of Health Office of Drinking Water. They just started a drinking water testing program for public pre-K through 12 schools and licensed childcare programs. Now, enrolling into this program is free. However, they are going to select facilities based on EPA's recommended priority criteria. So those priority criteria are facilities that serve children 6 years of age or younger, have buildings older than 1988, and 50% or higher of the children are on a meal plan. That's going to be their primary folks that they're looking for. And the Office of Drinking Water will assist you and provide all the materials, help you out with all of the logistics needed to get the water samples tested. And here I have all the steps of the program outlined. So it involves 6 stages. So you would enroll on the program website. I have it linked on this slide here. They will select the schools and childcare facilities based on those priority criteria. They will work with you to develop a lead sampling plan, make sure you have all the logistics ironed out. They will report the results to you based on your location and give you customizable actions. And the great thing is they also have funding for remediation. So if there is lead found at your location, they have money to help replace any of those lead service lines. I also have the information for the program supervisor here on the right in this box, Kendall Scott. Please don't hesitate to reach out to him if you have any questions or concerns about the program or would like any additional information. Now, before I move on to this next slide, I'm just going to clear those annotations. Okay, there we go. All right, so if it is discovered that you have lead in the water at your location or at your facility, It can be very expensive and time-consuming and burdensome to undergo lead service line replacement, and we acknowledge that. So I wanted to provide a lower cost option to reduce the risk of lead exposure via water, and that is point-of-use water filtration devices. So these are devices that you can attach at the point of use, so like the picture there, right on a faucet, and it will remove impurities, including lead, from water at that location. Research suggests that these filters can actually be very effective at removing lead from drinking water. And these last two bullets here, I have linked to guides for finding certified point-of-use water filtration devices. So you know that you're finding a good quality project that is certified to remove lead from water. It's a much more budget-friendly option. All right, now on this slide, I want to introduce you all to the Lead Hazard Reduction Program from the Virginia Department of Housing and Community Development. This is a grant-funded program that operates statewide to remediate lead-based hazards from residential properties. Now, this resource is primarily for families, but it is available for family day home providers as well that meet the income eligibility requirement. So as you can see here on the slide, we have the links from the Lead Hazard Reduction Program website. These are to determine your eligibility and to submit an online inquiry. Now, the key aspects of eligibility are that the household is at or below 80% of the area median income, and if it's owner occupied, having a child under the age of 6, either living at the home or visiting often. Renter occupied and multifamily properties are also welcome, and the child requirement is not in place for those rental properties. And just to kind of give you an idea, in the city of Richmond, 80% of the area median income is about $80,000 for a family of 4. Now, also listed on this slide is an overview of the program process. So this program is fully grant funded, and every step I go over is paid for by the grant. Once an application is approved, a lead inspection or risk assessment is ordered for the home. If present, lead-based paint and soil hazards are identified, and a scope of work is prepared to address them. Now, all hazards will be addressed, no matter the extent, by a licensed lead abatement contractor. A typical scope of work might include window replacements, siding repair or replacement, and scraping and repainting of baseboards and trim. The grant can also pay for minor home repairs to help protect that lead remediation work, and repairs just to make the home generally safer for children. Most often, families will need to relocate, typically for about 10 days or so while the work is completed to their home. The grant will pay for lodging if that is needed. And at the end, the home must pass a clearance test to ensure that lead dust has been thoroughly removed from the property before the family will move back in, to ensure that it is absolutely as safe as possible for those folks before they move back in. For those family day home providers operating out of older homes, please consider pursuing this lead hazard reduction program. For those operating larger childcare centers, please share this information with your families. It's a new resource and a great one, and the grant has really only been available for about 2 years. We're very fortunate to have an investment in the Commonwealth in remediating lead-based paint hazards, and we really encourage families and childcare providers to take advantage of this great program. Now we're coming to the end of the presentation. Like I mentioned before, I wanted to highlight some talking points to help discuss lead and lead exposure with concerned parents. Like I mentioned before, childhood lead poisoning can be a very scary and stressful topic for parents and caregivers, especially because it deals with the health of their small or young child. So these are great talking points for how to communicate with parents and caregivers about lead safety in your facility. One of the best things you can do is know the age of your building. If it was built before 1978, there is a high chance that there is lead-based paint present somewhere at that location. And if it was built before 1986, there's a high chance that there are lead service lines. If the building has been safely and properly treated to remove lead hazards already, share that treatment history with parents. It will let them know that steps have already been taken to ensure that there is a low risk of lead exposure at that location. If the building has not yet received any formal risk assessment or treatment, check for deteriorating paint on the walls, windowsills, any of those high friction areas like doorways or windows. If you find deterioration, create a plan to safely repair that area. And again, I have those safe repair tips, that whole EPA page linked here, and share that treatment plan with parents. So including information about intent to remove children from the area while the work is conducted, their repair schedule, the reason for repair, things like that. If lead is found in your facility, communicate with parents what the facility is going to do to safely remove those lead hazards. And I have a sample communication plan for sharing that information with parents in our toolkit resources. And that brings me to this great resource to kind of supplement this training webinar. That is our lead poisoning prevention resource toolkit. You can access the toolkit on the website here, the Department of Health Child Care Centers page. The toolkit contents include the recording from this webinar, which I will add after we wrap up sometime this week. This whole slide deck, so all of these links and all this information will be available for you all to browse as needed. General lead safety resources, the sample communication plan for conducting lead hazard testing at your childcare location, resources for educating parents on blood lead testing and lead poisoning prevention in general, and then a whole section on lead and water safety resources just to kind of help you understand lead and water testing and water safety in general. Now here I also have just some great resource kind of split it up by agency. I have links from the CDC, links from the Department of Health Childhood Lead Poisoning Prevention Program, and then also just miscellaneous links from things like the EPA or the Consumer Product Safety Commission. These all provide additional information or just go more in depth into what we've talked about today. Here I have all of the contact information for the folks that supported the development of this webinar and this toolkit. Please don't hesitate to reach out with any questions you may have about this information or lead safety in general.